Hello dear friends, we have come up with our another video regarding the procedures that we carry out during our infertility treatment. So today we will be talking about is the SSG, that is saline salpingography. So what is this SSG and when it should be performed, and what are the results that can be mm, result that can come from this test, and what all we do with the results after that, how should we proceed ahead, that we will discuss in this video. Now, coming to saline salpingography, so generally in our clinic we perform this procedure under anesthesia, that is we give a short general anesthesia and then we perform this procedure. And it is generally performed post menstruation, that is after you finish your menstrual period. After that we perform this procedure. So like generally we perform it between 5th day to 10th day of your cycle, menstrual cycle. So we ask you to come nil by mouth, that is you have to come without eating or even drinking water. You have to come at least 6 hours of nil by mouth is required. Generally we perform this procedure in the morning hours. Okay, so after you come for the procedure nail by mouth, the time taken for this procedure is only 10 to 15 minutes. So we take you in the operation theater, then like the position taken for ultrasound, same position is given for SSG. Now in this procedure, we instill normal saline, that is NS is instilled through the cervix, and we first pass is the some catheter. Either it can be a saline salpingography catheter or the Foley's catheter we pass through, and then we push the saline through this catheter and we see for the spillage of this saline from the tubes, that is right side fallopian tube and the left side fallopian tube. So both side free spillage we see for in the saline salpingography. So if at all the free spillage is there on both sides of the tube, that means the tubes are open, they are not having any block. But if at all there is no spillage seen in either of the tube or both the tubes, that means either a single tube is blocked or both the tubes are blocked. So this we can then come to a diagnosis of tubal blockage, that is either unilateral or bilateral tubal blockage. So if at all these tubes are patent, so two results we can get: either the tubes are patent. So if the tubes are open, that means they are patent, that means they don't have any pathology that can be detected on SSG. So we can go ahead with IUI. So intrauterine insemination we can go ahead, or whatever the plan has been given, either ovulation study or IUI we can go ahead with. And if at all the tubes are blocked, that means either we can go ahead with further evaluation in the form of laparoscopy in which we actually put a camera inside the abdomen and we see for whether really the tubes are blocked, and in this we put a dye, methylene blue dye, and then we see for the dye coming out of both the tubes. And if at all in laparoscopy also the tubal blockage is there, then we go ahead with IVF treatment. Or if at all in SSG only it is confirmatory, then also we can directly go ahead for IVF treatment. And if at all unilateral block is there, then of course we can go ahead with 2 to 3 cycles of IUI, and if at all we don't get success in that, then we can go ahead with IVF. So this is how we do the procedure. So post operative you may have some pain after the procedure. So for that, analgesics we generally give, and antibiotics for 3 days we give. And post operative you may have some pain, but generally for 1 day you may then the milder pain is there. And after that the further plan is discussed with you, and then accordingly you are called. So this is about the short procedure of SSG, that is called saline salpingography. So this procedure is routinely performed as a tubal testing procedure. It is actually much better and painless procedure as compared to HSG, that is hysterosalpingography, where the dye is inserted into the uterus. So that HSG procedure is actually painful as compared to SSG. So thank you so much, and thank you for watching this video.